Hi, my name is Andrew Sears, and I'm going to give an overview of licensing and certification for addiction counseling. I'm also going to be covering licensed professional counselors and other types of licensure for counselors. So in the field of addiction counseling, if you go to a typical licensed treatment center, and many of you may not work for licensed treatment centers, but it's just helpful to understand that this is kind of how the world's organized. Often you'll have a psychiatrist or an MD kind of at the top, and then under that you'll have licensed professional counselors. You might have master addiction counselors or addiction counseling supervisors, and then you'll have licensed clinical social workers, and then you also have clinical psychologists. Now, in a lot of states, why this is important, in a lot of states, these three can be billed. LPCs billed to Medicaid, can be billed to insurance, licensed clinical social workers and clinical psychologists. They're licensed, and the key thing is that opens up a lot of money to the treatment centers. So for a lot of treatment centers that bill to insurance, or if they bill to Medicaid, then it opens up money. Now, in some states, master addiction counselors are billable. And usually the way it works is you're going to have licensed addiction counselors that, level 1, level 2, that's going to work under these. So, if you have a large treatment center, you might, for each LPC, you have 5 LDACs under them. And in different states are going to call these different things. And then under those, you have peer specialists. Now, there's also professional development path. So you have this peer specialist path, which really is basically designed to be the first rung on the ladder for a lot of people. A lot of people, though, go directly for the licensed addiction counselor. And, a lot of our addiction counseling courses are helping prepare our students to go. So if you don't have the CAC1 or CAC2, then, we can help prepare you for that, both the undergraduate or graduate. Now, our graduate programs in addiction counseling are really aimed at helping to equip people to become a master addiction counselor. But that also could be a complement into some of these other programs. In particular, we've designed our graduate program to align with LPC requirements. So our in a lot of the master's programs for addiction counseling can be 36 credits or sometimes 48 credits. And LPC programs are generally almost always 60 credits. So now this next slide talks about why the field of addiction counseling exists. So why don't we just have everyone be generalist counselors? Why don't we only have LPCs or only MSWs? And the whole field of addiction counseling exists based on the belief that addiction-specific training can equip addiction treatment professionals to better serve clients than traditional counseling programs. Now, putting this in cultural terms, my own assessment is that most traditional counseling training is by upper middle class folks for upper middle class folks, which is fine. I think that's great, but there can be this cultural disconnect in the field of addiction counseling. That's not only from lacking lived experience and experience with those with addiction, but it can also be kind of a social class divide in many ways. So what addiction counseling does is it provides street level training that has increased value and increased priority on lived experience. A lot of people in the field have lived experience. A lot of people don't. But there's increased value on that, whereas in LPC's lived experience and addiction might be actually viewed as a negative. And then the other thing is an emphasis on practical practice over theory, whereas a lot of LPC programs are focused a lot more on theory. The courses are focused a lot more on theory, and then you get the practice through your practicum and internship. Now, the third reason is just some of the limitations of traditional counseling programs. So if you go through a CACREP program, so that's the primary accreditor for for licensed professional counselors, In most states, even if they're not aligned, if they don't require CACREP, they're still often aligned with CACREP standards. CACREP programs typically only have one addiction-specific course. So it's just not enough to really prepare people. And I've talked with a lot of organizations that do, work with those in addiction recovery, and they just say, LPCs aren't prepared. And, this emphasis on theory over practice. So now, if you look at how addiction counselors, the competencies by SAMHSA, these competencies here are all highly practical. So they kind of put in the middle the theory, but then all of these things are what you do. This is more of what you know. But these are all, competencies that are focused on what you do. And a lot of it's just day-to-day practical, documentation, and things along those lines. So another way of getting a good sense of that is to compare SAMHSA's TAP21 and CACREP standards. So SAMHSA's TAP21, which I just showed you on the other diagram, you have these 8 standards. But then for LPCs and CACREP, there's some similarity. So clinical evaluation is, similar to assessment and testing. But a lot of these things like treatment planning, referral, service coordination, case management, client, family, and community education, and documentation, these generally have very light coverage. There might be coverage in CACREP's addiction counseling specialty standards, but the core courses required in CACREP often, aren't focused on this nuts and bolts. They view this more as kind of technician type things. And then there's other things that map, well. So counseling in the helping professions is what they call it for CACREP, and group counseling, group work, the ethics maps. And then there's a lot of things that LPCs focus on that aren't covered as much by SAMHSA. And they actually do fall somewhat into transdisciplinary foundations, but they're not covered as thoroughly. So an entire course on social and cultural diversity, and often every course will have at least one lesson on that. Human growth and development, career development. This might be things like, career testing, and a lot of testing of personality types, and, for people who might work in schools. And then research and program evaluation. So that's not covered as much in SAMHSA. So these are some of the differences. Now, City Vision, we're designing our graduate program to be aligned so that we could map our credits into CACREP programs. So if you wanted to get a master's at City Vision and then move to a CACREP program after that, then you can gain a lot of this competencies in addiction counseling, and then you could move into that field. Now, we don't guarantee the credit transfer, especially depending on where you go, but we have been working particularly with Liberty University on that. So in summary, the differences between the TAP21 addiction counseling competencies and CACREP: you have a street level focus versus a clinical focus. You have working class oriented versus middle and upper middle class. So non-majority culture is what I would say is more centered, where this is majority culture dominant. Now, they may teach a lot about diversity at CACREP programs, but addiction counseling as a field is a lot more diverse. So, it's a difference by, do you understand diversity because you've lived it, or do you understand diversity because you took a course in it? And that's not always true. I'm just saying as a generalization. These are all generalizations, right? Because there's plenty of diversity in LPCs, but I'm saying that there's going to be more diversity, I would say, in addiction counselors on average. And just another way of putting that, if you look at the clients in addiction treatment centers, the addiction counselors often are going to look more like the demographics of the clients than, say, LPCs or MSWs. So more practical training versus more theoretical. This is addiction treatment centered, where this is counseling centered. So counseling may be one component of addiction treatment. One big difference, and this is why we encourage people to, get certified as addiction counseling, go through our graduate programs, but we encourage people to go on for an LPC. because this is the best of both worlds. You start, addiction counselors are lower pay. It is kind of a social class based world, and the reality is in a lot of treatment centers, addiction counselors are second class citizens, and they're paid like second class citizens. So if you want to move up, this is a way to get there. One of the best things about addiction counseling is there's multiple rungs on the career ladder, so it's easier to move up. Whereas with LPCs, the career ladder typically starts with a master's. I mean, you can get a bachelor's before that, but you don't have any sort of ability to do, to work in the field until you get that master's. Often on the addiction counseling side, they'll, judge the LPCs and MSWs as not as connected with the clients. Whereas the LPCs and MSWs might, judge the addiction counseling people as not as well trained. One of the biggest differences, and this relates to lower pay, is there's a limited ability to bill to insurance and Medicaid. And there's a greater ability to bill to insurance and Medicaid. And even for nonprofits that don't do this, a lot of, faith-based nonprofits don't bill to insurance or Medicaid. Funders like to see that there's LPCs on staff too. It just, helps with professionalization. And also addiction counselors, as I mentioned, are often supervised by LPCs and licensed clinical social workers, is a big difference. Now, another key confusion point is what's the difference between a certificate, a certification, and licensing. So really what it comes down to is who is giving you the credential. So a certificate is typically provided by a university. So City Vision has a certificate program. If a certificate's not provided by an accredited university, they're just a piece of paper. Our certificate programs always build towards a degree. Then you have state licensing and certification. This is really what matters. So a state authorizes an individual to be an addiction counselor. So most states use the word certification for addiction counselors, while a few use the term licensing. Almost all states will, for licensed professional counselors, LPCs, they're going to use the term licensing. If a treatment center wants to become state certified or a licensed center, you're going to have people who have those. That's a part of the standards. And at the highest level of licensing and certification, it's often tied with insurance and receiving Medicaid. Now, then there's a third category called national certification. So that's for the National Association of Addiction Counselors, NADAC, and IC and RC, which is kind of an international counterpart, and their standards are pretty aligned in a lot of states. Almost every state either aligns with NADAC or IC and RC standards. But those organizations also provide their own certification. So typically, those are pursued as an added credential beyond state certification. So if you want to be, and one of the most common is Master Addiction Counselor. So a lot of states don't even have a Master Addiction Counselor certification. So a lot of people who want to get that next level will go to NADAC. Now, there's some states that they say if you want to become a Master Addiction Counselor in our state, you need to get it through NADAC. So some states actually defer to NADAC for that. So the two organizations that are out there, so NADAC is the National Association for Alcoholism and Drug Abuse Counselors. People just always call it NADAC. They almost never use the long name. It's U.S. focused. They have these. So I mentioned in the previous one, there's national certification. So these are some of the national certifications they have. They have Peer Recovery Support Specialist, NCAC 1, NCAC 2. They have Nicotine Dependence Specialist, Adolescent Addiction Counselor, and then Master Addiction Counselor. Now, a lot of states will map their standards to this. And then IC and RC, the International Certification Reciprocity Consortium. So for a lot of, if you move from one state to another, this is the group that kind of has a lot of the agreements for that, also internationally. So they have peer recovery certification, prevention specialist, certified criminal justice addiction professional, alcohol and drug counselor, advanced alcohol and drug counselor. So these are going to kind of correspond to NCAC 1 and 2, and then clinical supervisor is the difference. Now, as I mentioned, most states are going to have a licensing model from NADAC or IC and RC standards, and those standards also are aligned with SAMHSA. So they're going to require some combination of education hours, and in most states, city vision courses typically count towards. There's some states that don't. And then an exam, so our courses are aligned to help you pass that. Supervised practicum hours, and you can get that through our practicum course, and then work experience hours. So let me just show an example in Missouri. So in Missouri, to get the level 1 certification, you have to have 180 education hours. So one of our courses is 135 hours. So 2 courses would be enough for that. Then you need to have 300 practicum hours. So you could take our practicum course, and you could take it more than once if you needed, but then you need to have experienced hours. Now, typically, some states will require that someone become an certified addiction counselor supervisor, but a lot of states will also allow anyone with an LPC or clinical social work license to do that, and then you have to pass an exam. So in Missouri, it's the IC and RC addiction counseling exam. Now, say you got your license in Missouri and then you wanted to go for NADAC certification. So they have a little higher. So if you wanted to become, this is just another credential you can add to your resume, National Certified Addiction Counselor 1, you would need to have more education hours, more experience hours, and then you'd have to pass one of those exams. And NADAC requires you have an active state license. So let me kind of talk with you a little bit about our addiction counseling program path. So our programs are designed, so at the undergraduate level, so we have addiction counseling at all of these levels. So addiction counseling program. So we have an undergrad certificate, so that's 6 courses, 16 to 18 credits, and then that can build towards an associate's, and those credits count towards an associate's, and that can count towards a bachelor's. And then same thing at the graduate level. So we have an addiction counseling graduate certificate, and that could go towards a master's. At the point of this recording, we've submitted our master's to our accreditor, but that's not yet been approved. So the only thing that we can offer at this point is our graduate certificate. But I want to show that so that people are aware of what we're trying to build towards. Now, in that master's that we have submitted, there's 3 concentrations, and this is really important if you're in the graduate program, because you need to make sure you've picked the right concentration. Now, so the first concentration is a clinical addiction counseling program for addiction counseling certification. Now, if you take that, you're going to have courses that are focused more on skills, and a practicum course is required. So if you can't find a practicum site, you can't find someone who can be your practicum, your local practicum supervisor, you're not going to be able to get that. Now, here's what's worth stating. In most states, you're going to need to go for that certification or that path if you want to get certified. Now, another way you could go is, so we've developed what's called a pre-LPC track, and we're trying to optimize that track for transfer to Liberty University's 60-credit LPC Masters. The reason we aligned with theirs is because they have what I believe is the largest Christian counseling program. Whenever we last talked to them, I think they said they had 13,500 counseling students nationally. So they can work in all 50 states. And their program's 60 credits. We are hoping that our students can get up to 27 credits transferred towards that. So what that would do is our program's a lot more affordable than Liberty, so you could both get a lot of addiction-specific training, but also transfer that to Liberty, and then you could get, essentially, work towards an LPC path. Now, the third concentration is a ministry concentration, and that's really for people who do not plan to go for an LPC, do not plan to try to get addiction counseling certification in their state, but they just want to learn this to be able to make a difference in people's lives. They're at a ministry, they may not care about getting the certification. It maximizes the flexibility for that. So the last thing I want to cover is how this fits into SAMHSA's career ladder. So SAMHSA has a career ladder, and if you go to their website, there's a PDF that kind of has this summary. And they have it for each level of education, and we cover certificate, associates, bachelor's, and graduate also, and eventually have master's. We don't have any plans for doctorate. And for each of these, you have different, what's the career ladder level, what's the certification. So I've talked about these certification. In most states, and this varies, but in most states, you only need high school diploma and GED and some minimal training to become a peer support specialist. Now, in some states, the level 1 addiction counselor, you may not need to have a bachelor's. In other states, it's required, and in I would say in a high percentage of states, if you have an associate's or bachelor's, it reduces the number of hours that are required significantly for that. So that's why if you see here the level 1, level 2, in a lot of states you can get the level 1 with a certificate and associates, whereas level 2 in a lot of states you have to have a bachelor's degree. Now, in most states that have a master addiction counselor, you need to have a master's degree. So if you're in a graduate program, that's really what this is helping equip you for. And then that could be a stepping stone into an LPC. So that's, these programs up here are the programs that we offer. So hopefully all this is helpful. I realize this is a lot of information, so you may need to go back and reread this. I would encourage you to, do some searches on the internet to look up these things. But what you're going to want to do is to think through your full career plan, because think of it as a career ladder. So if you start and say your next goal is to become a level 1 addiction counselor, then you want to try to work towards a level 2, then a master addiction counselor, and our programs can help you get there, is essentially what we're trying to do. And ultimately, where we can't yet offer is this licensed professional counselor, but that's the reason why we developed this program pre-LPC to transfer. So hopefully all this is helpful. If you have questions, please ask your faculty member. Thanks a lot.